If you're having back pain, then this video, we're gonna go through the specific exercise that we'd have you do to be able to get rid of it at home. It's gonna take 10 minutes. It's gonna be a follow along video. So be ready to do the exercise and follow along. These are gonna beat back pain. They'll get you out of back pain right now, right after the video. But if you stack it up for a few days, you're gonna be able to beat back pain. Let's get right into the exercises. Exercise number one, we're gonna loosen up the psoas. So we'll have a timer on the screen where I'm gonna lay down on my back, and then I'm gonna take this off because I want something kind of pointy, and I'm gonna go right inside my pelvis, and I'm pushing down and out. So I'm driving and I'm just combing my pelvis right here, loosening up the biggest hip flexor in the body. So our small intestine is here in our abdomen, but it's not in this area. We're not gonna hurt anything. We wanna be specific pressure in this area around 3 or 4. We want it to be uncomfortable, but tolerable. If you lift your leg up, you'll feel that muscle contract. You don't have to do that. It's typically more uncomfortable. But what we want to do is just put pressure right here. So any type of massage roller, stick, anything that you can dig in here. There's some a Psoas. There's a lot of different tools that people use to work on this major hip flexor, but this is sufficient. We do it all the time with our clients. I use it at home, and that's a minute. So now I'm going to go to the other side, and I'm going to get on the ilium. So I got to loosen up both sides. No matter if we have pain on one side, we always want to work on both sides because our body is reciprocal. We're going through the right leg, left leg when we walk. And so we got to open up both sides. If we're going to get a full resolution to our back pain, we got to work on both sides, top to bottom. So I'm just putting pressure down and out into this iliacus and psoas muscle. And at the end, we'll explain exactly with the anatomy what you're doing. But right now, I just want you to focus on feeling that 3 or 4, that uncomfortable sensation, but it should be tolerable. We're not able to inflict as much pressure on ourselves or push as hard on ourselves as somebody else that's working on you. If you've had a massage, somebody digs into you and it's not pleasant, we're not able to do that level to ourselves, and it's not always necessary. If we're consistent with this, then you don't really need to go that hard. It's really about consistency with that subtle 3 to 4 discomfort right there. So that was a minute. Now, number 2, I'm gonna get to where I'm rolling out my glute. So this is a lacrosse ball right here. So just this lacrosse ball on the end, and what I'm gonna do is I'm gonna lay down. So you can use a regular lacrosse ball, you can use a baseball, you can use any type of ball that has some girth to it. A golf ball is not gonna work really well. But this is just a lacrosse ball right here. So what I'm gonna do is I'm gonna lay down and I'm gonna put it off to the side right here. I'm not sliding it underneath my butt. I put it off to the side right there. And then now I'm rolling into it. I wanna get the side of the glute. And I'm gonna support my head, my hips, my knees, my abdomen. They're all in the same direction with my chest and my head. And I'm just relaxing right here. We don't have to do a bunch of other stuff. We're finding a tender spot and we're just sitting in it. I wanna sit in it for 30 seconds and now I find another tender spot. I'm just shifting my hips forward a little bit, finding another tender spot. If this is extremely tender, just roll your body back a little bit so that it's not too bad. We wanna stay at that 3 or 4. This is one where a lot of people get really, really tender. When you do this consistently, it's gonna start to not be as tender. When I'm doing it at home, because I do it almost every day, I cannot find tender spots because I've done it so much over time. If you contract the glute, it's not gonna be very tender. So now we're moving to the other side, and I'm gonna go right here, off to the side, and you'll see from the back side, I'm rolling into it, I'm finding that tender spot, and I'm just relaxing my head, relaxing my leg. Your leg can hang. And so I'm just sitting right there. This is a follow along. We're doing it for an entire minute, but I'll go ahead and show you on this side my setup again. I lay right here, get that lacrosse ball right here off to the side. I'm rolling into it. So each one, I'm going to 2 different spots. So that one's tender, and then now moving forward, that one's tender. 2 spots for 30 seconds. And I'm just resting into it. To make it more intense, if you want to, if you're not really feeling it, you can wiggle this leg, right? And so we're loosening that up. What I don't want you to do is wiggle through your low back. That's gonna cause us more problems. It's gonna make it much slower. So I can wiggle this leg, but not the lower back. So that's for a full minute. And then now we're gonna go into our exercises. So we've loosened up that muscle tissue on the front of the pelvis, on the back of the pelvis, and now we need to activate the correct muscles. So these are really specific exercises we do here in the clinic with our clients. And so I'm gonna set this up, just any band that you have at home. I wanna put it above the knees, and then I'm gonna do an exercise we call Teeters. So I'm going to set up right here. So let's get this moved backward. You can see more of my legs. So my feet are slightly turned in, and then I am pushing my knees out. My chest stays in a neutral position, and I'm gliding on one side and then the other. But I'm making sure that my pelvis isn't dropping down. So I'm tight in my core, and I'm just stabilizing right here. So my abs and my glutes are working right here. So I'm in a good athletic position, and I'm doing it for a minute. So I'm just stabilizing. What I don't want is for my feet to turn out. So I'm gonna move this out of the way, make sure that you got a good view of my feet right here. They are not turning out. It'll be natural that we start to turn out because we'll want to use our hip flexors. We keep those feet slightly turned in, we're going to use more of our glutes. So that's our teeters. Now we want to go into side steps. So side steps, we get into a good athletic position right here. And then we're gonna go to the side, we're doing 5 steps, and we're gonna come back. So same thing, feet slightly turned in, my chest is down, my butt is back, but my back's in a neutral position. Really, really big focus on not doing this. That's gonna cause you pain, you'll feel it immediately. So make sure that when you're coming down that the face stays in line with the chest. If my eyes are here, my chest is here, this stays in one position. So if you lock your eyes on the wall, we're gonna immediately go into extension. And that's, if we're dealing with back problems, that's a primary cause of our back problems is that we extend all the time. We overuse those back extensors. So I'm here, and then now I'm driving, and I'm gonna go side to side. So I'm gonna show you from the front. So toes pointed in, 1 inch little steps, 1 inch little steps. This is the biggest problem that I see with clients and people at the gym. Often they do this exercise, they do big steps. This is 1 inch little steps. We keep the glutes engaged, the abdomen engaged, and we're just doing 10 to each side, but I wanna do it for a minute. So I'm going back, really challenging these muscles, challenging the glutes, challenging the abdomen, and I'm firing up. So I'm making my glutes work without making my back wiggle. So that's a big focus, is getting those glutes in the hips to move without moving through my lower back. And this one, it's getting me a little sweaty. I'm burning in the glutes. It's like, this is really important that we burn in the glutes and use these muscles. Abdomen and butt need to fire together. Make sure that our back extensors and our quads are not firing together. 1 inch little steps. You're gonna be compelled to take a bigger step. Don't do it. 1 inch little steps. And that's it. So now what we're gonna do is we're gonna do a hip hinge squat. So we can do it with the band, or we can just take the band out, because we really need to practice our form right here. And what this comes down to, if I drop something and my back's bothering me, then I do this. I don't wanna bend through my back. So I pick it up. But then if my knees start to bother me, then I bend through my back. We don't have to sacrifice the knees. We don't have to sacrifice the back. What we need to do is learn how to hip hinge. We have to train this position that I'm going to pick something up, I get close to it, I shift my hips back, my face stays in line with my chest, my butt is back, I'm balanced, more of my weight is on my heels. I'm gonna pick this up, I'm driving my knees out, I'm gonna pick this up, my hips go forward. It will not cause back pain. People are amazed when it does not cause back pain. So what I'm gonna do to set up for this exercise is when you're at home, I want you to do it against a wall. I want you to measure your foot away from the wall, move your foot off to the side, and then go about shoulder width. We keep the face in line with the chest, and we wanna make sure that the knees don't wiggle inward. We have our knees outside the second toe, I'm driving my butt back, touching the wall, then I'm pushing my butt forward using my hamstrings and my glutes. So I'm driving back, driving forward. This is a hip hinge squat. It's not a regular squat. We gotta exaggerate this hip hinge and coming back. The lower leg stays totally vertical and the back does not go into extension. And so I'm gonna do it up against this table right here. So I'm setting up, I want you to follow along now. So we're gonna do 2 sets of 15. So I'm driving back and I'm touching, coming forward, drive back, touch, come forward. That's 3, 4, 5. Some people make a robot noise. Some people like me. Is that a robot noise? I don't even know if that's a robot noise. I'm kind of far away from it. I want to come a little bit closer so I can tap it. We want your butt bones to touch the wall. So try to think about your butt bones touching the wall. There's 8, 9, 10. It also helps sometimes to put your hand right here on the butt bones and push back into your hand, allowing the chest to come down. Face stays in line, not locking our eyes on anything. And there's 15 right there, just slow and controlled. Also watch out for your chest popping up and doing this. Starting with your chest, that's gonna cause back extension. So now, we always rest about 10 seconds in between reps because we're trying to fire up muscle groups. We are not doing hypertrophy. We're not doing a heavy lifting workout to build big muscles. With that, you want to take longer rest breaks. This 10 seconds to 30 seconds, get right back into it. We set up, lower leg stays vertical. I'm driving back. I can put my hands right here too. I can put my arms out. A lot of times people put their arms out like this. The problem with that is that when we get really far out, our back extends because our lat gets tight. So that was 5. I'm just gonna, I kind of keep them right here, or I put them on my belly to make sure that I'm not extending. So you see that backward and forward motion. That was 10. Here's 11, 12. Make these last ones really slow. 13, 14, 15. Every time I come up to neutral, and then I come back, I come up to neutral, and I come back. So that's it. You do that every day, preferably twice a day. If you're dealing with a really acute bad bout of back pain, you do this. We loosen up the front of the hip flexors, we loosen up the glutes, and then we fire up the glutes in a neutral pattern, and then we do our hip hinge so that we can bend over and pick things up. Twice a day, we're gonna beeline it to success. You stack that up over a couple days, you're gonna be doing really well. Leave us a comment. Let us know if you need any more dive in, you need more information on exactly how to do this stuff. If any of it bothers you, back off of it, come back to the video, look at your form, even video yourself at home. It's really helpful. Get your spouse involved. Let's make sure that we're doing this stuff correctly because it really, really works. What we are doing is we're moving more through the hips. We're making motion happen here through the hips and the pelvis, and we're limiting motion at the low back. And that allows us to get rid of inflammation consistently so that we can continue to get out of back pain so that we're not having aggravation all the time. I'll see you in the next video.